It is essential to be able to identify the symptoms of a heart attack, which can differ from person to person. A person can have a heart attack and not realize it, in which case they may not seek the necessary emergency medical attention. This could result in long-term harm to the heart. Myocardial infarction is the term used in the medical field to refer to a heart attack. MI. The many signs of a heart attack are discussed in this video, along with how those symptoms may differ in females and people of advanced age, and when it is appropriate to seek medical assistance. In addition to that, it examines treatment options as well as prevention and risk factor considerations. In most cases, a coronary artery will get blocked, leading to a decrease in or complete cessation of the nourishing blood flow to the heart muscle. This will result in a heart attack. Pain in the chest is the symptom of a heart attack that is most widely recognized, but the symptoms that a person experiences might vary depending on their gender and age. It is critical to recognize the early warning signs of a heart attack and seek immediate medical assistance when one occurs. The right treatment can lessen the severity of the damage and improve the patient's chances of making a full recovery. The majority of people are aware that chest pain is a common symptom of a heart attack. On the other hand, a heart attack may not just impact the heart but also the rest of the body. People of different ages and genders may have diverse experiences with the symptoms of a heart attack. The majority of heart attacks do have numerous distinguishing symptoms, which, according to a trusted source from the Centers for Disease Control and Prevention (CDC), are as follows. To the chest. Pain or discomfort in the center or the left side of the chest is a common symptom of a heart attack. It could feel like a stabbing pain, or more like squeezing fullness, or uncomfortable pressure. It could also feel like it's getting worse. I'm having trouble breathing. In most cases, this is experienced concurrently with chest discomfort. However, shortness of breath can also begin before the onset of chest discomfort. Ache in the upper body. A person can experience pain or discomfort in one or both of their arms, which may then radiate to both of their shoulders. In addition to this, there may be a pain in the back, jaw, or neck. I'm becoming a little dizzy. Someone may feel faint, weak, or break out in a cold sweat. Symptoms that may indicate a woman is having a heart attack. The warning signs of a heart attack may manifest themselves differently in women, and they may appear less obvious or unrelated to heart problems. The following are some of the most prevalent signs of a heart attack in women, which may or may not be accompanied by chest pain, sleep disturbances, extreme shortness of breath, nausea, indigestion, or other digestive upsets all over the body, aches, a general feeling of being sick, discomfort in the back or upper body, sleep disturbances, weakness that comes on abruptly, extreme shortness of breath. Because of the widespread association of heart attacks with chest discomfort, ladies frequently misinterpret their symptoms and put off going to the doctor as long as possible. It is essential for everyone, but particularly women, to be aware of the signs of a heart attack, even if they differ from the norm, and to seek quick medical attention when necessary. In elderly adults, the warning signs of a heart attack. Similarly to females, older individuals who have heart attacks may exhibit symptoms that are not usual for the condition. Chest pain is a condition that occurs relatively seldom, and asymptomatic or silent heart attacks are more common in older people. If someone is having a silent heart attack, they may not notice any symptoms and may feel pretty good, except feeling particularly weary or short of breath. In addition to this, they might exhibit one or more of the symptoms that are often linked with heart attacks in women. When to seek immediate medical assistance in an emergency. If someone is experiencing a heart attack, the National Heart, Lung, and Blood Institute suggests that taking immediate action may be able to save their life. Even if a person is not quite convinced that they are having a heart attack, it is in their best interest to seek emergency medical assistance as soon as possible to reduce the risk of any potential damage to their heart. When treatment is not received, how long does a heart attack typically last? If a heart attack goes untreated, there is the potential for very serious repercussions. If someone thinks they could be having a heart attack, they should never hesitate to get medical help. If someone has symptoms of a heart attack for more than 15 minutes, the heart muscle cells of that person are at an increased risk of being damaged. Once symptoms appear, a person has less than 1 hour and 40, 5 minutes to seek medical attention before irreversible harm occurs. Causes. The heart can't function normally if it is deprived of oxygenated blood, which increases the risk of having a heart attack. This might occur if there is a partial or complete blockage in one of the coronary arteries. Coronary heart disease is the most prevalent factor that leads to coronary arteries becoming obstructed. Atherosclerosis is the process through which fatty deposits and plaques made up of cholesterol and fat can form on the artery walls when coronary heart disease is present. The plaques, when they build up over time, restrict the arteries, which eventually leads to an obstruction in the blood flow. The use of recreational substances like cocaine, for example, has also been linked to an increased risk of a heart attack. Aspects of danger. The likelihood of an individual having a heart attack is raised by several different factors. These include having a masculine gender, being above the age of 65, or having a history of cardiovascular disease in your family. People of African, Mexican, and American Indian heritage are at a higher risk, suggesting that race also plays a role in this phenomenon. There are also risk factors that can be altered to reduce the likelihood of having a heart attack. These are the following: cigarette use and alcohol consumption, obesity, a lack of physical activity, elevated levels of both cholesterol and blood pressure, diabetes, stress. The good news is that people can change, treat, or control the modifiable risk factors to lower the likelihood that they will suffer a heart attack. Evaluations and diagnostics. Anyone who is feeling chest pains or feels like they could be having a heart attack should get medical help right away. A heart attack will be diagnosed by a physician after considering the patient's symptoms, age, overall health, and family medical history. In addition to that, they will conduct tests such as electrocardiography, sometimes known as an ECG, is a test that measures the electrical activity of the heart. Imaging tests, such as chest X-rays and echocardiograms, and coronary angiography to find blockages in the arteries. Imaging tests, such as chest X-rays and echocardiograms, to determine whether or not the heart has been damaged. Treatments. If the results of the tests indicate that a person has suffered a heart attack, the doctors may suggest the following operations for the patient: coronary angioplasty to open up blocked arteries, stent procedure to support an artery with a wire mesh tube, bypass surgery to create new routes for blood to flow around the blockage, implantable devices such as a pacemaker to help the heart beat normally, artificial heart valve surgery to replace abnormal or leaky heart valves, and so on. A heart attack can also be treated with medication that helps relieve discomfort, thins the blood, breaks up clots, and relaxes blood vessels. If you're having one, talk to your doctor. Complications. Attacks on the heart can cause damage to the heart muscle, which can lead to consequences including the following: arrhythmias, often known as abnormal heart rhythms, failure of the heart as a result of significant damage, sudden cardiac arrest owing to electrical faults. The extent of the damage that was inflicted on the heart muscle by the heart attack frequently determines the severity of any consequences as well as how long they last. Prevention. Even though people can't control all of the factors that put them at risk for heart attacks, such as their gender, age, or heredity, changing their habits could help prevent these attacks. These are the following: stopping smoking, selecting a nutritious diet that is low in sodium, saturated fats, and sugar, limiting alcohol intake, exercising frequently, controlling blood sugar, maintaining healthy cholesterol and blood pressure, and so on are all things you can do to improve your health and your outlook. Having a heart attack does not, fortunately, signify the conclusion of a normal, healthy life for the vast majority of people. On the other hand, approximately 20% trusted source of people over the age of 45 will suffer a second heart attack during the first 5 years after their initial incident. Because of this, it is essential to place a strong emphasis on leading the kind of lifestyle that can reduce the risk of developing cardiac problems in the future. Even while the majority of people are aware of the basic symptoms of a heart attack, such as discomfort in the chest and shortness of breath, they may not be aware that ladies and persons of advanced age can have a different experience during a heart attack. In these people, the symptoms of a heart attack such as excessive weariness and indigestion, may seem unconnected to one another. If someone is having any symptoms that could be related to cardiac problems, they should seek medical assistance as soon as possible. Someone's life can be saved, and irreversible cardiac damage can be avoided if therapy is administered as soon as possible. Do you like this video? Give your valuable response in our comments section below. And don't forget to subscribe to our YouTube channel for more videos like this.